It's May Day, and workers are making their voices heard. Few are louder than NHS workers.
Counting just on my salary, definitely I can't afford many stuff. I have my daughter and family to support, so I don't go around to pay for the holidays.
And what do you think about the situation?
I think it's not right that they don't get enough money because they work very hard to save people's lives.
1, 2, 3, 4. More nurses on the floor.
For the first time, nurses who work on cancer wards, A&E and intensive care have joined the walkout. The government has offered them and other NHS workers a 5% pay rise, but the Royal College of Nursing says it's not enough.
At the moment, that offer is not acceptable for what we want to fix. So we want to address recruitment and retention within the NHS and particularly within the nursing workforce. And unfortunately, 5% is not going to be able to do that.
The dispute rumbles on, and in the meantime, patients are losing out.
Unless I have the operation, it's unlikely I will live to the end of the year.
Sue needs life-saving surgery on one of her arteries, but her operations keep being cancelled. She's among more than 500,000 patients who have seen their vital medical appointments delayed.
It was delayed a second time because of the doctor strikes, and I had a phone call on Friday to say, we're on a go for Monday, today, and 4 hours later, they phoned me up and said we have to cancel Monday because of the nurses' strikes. So, you know, it's just a waiting game at the moment and hoping that I stay alive. It's frustrating because there is a light at the end of the tunnel, but at the moment, I can't get into the tunnel.
The latest action comes ahead of a critical meeting between NHS bosses, health unions and ministers where the latest pay offer will be discussed. However, the nurses say they don't need to wait for the outcome of that. They already know that the offer isn't good enough, and they've rubbished any suggestions that they're acting prematurely.
What do we want? Fair pay. Where do we want it? Now.
So while the Royal College of Nursing warns defiantly that strike action could last until Christmas, health unions are expected to approve the government's offer tomorrow. That means members could see a deal they rejected imposed on them.
A deal that most of the affected staff have accepted. And now the question is whether all the unions will tomorrow accept this deal and we can move on. But as I say, that will still leave major issues the government needs to address in terms of staffing in the health service.
The government hopes the pay offer will provide a framework for negotiations with junior doctors tomorrow. Despite the clamour, a deal with health workers seems closer than ever. Gurpreet Narwan, Sky News.